You mentioned the PCR test in the book. Do you use that?
All the time.
Yeah, okay. Yeah, very interesting.
Yeah, so PCR is polymerase chain reaction analysis for DNA. And we're using it in the mouth.
Yeah.
Or where we're specifically using it is, for me, when I remove a tooth that has had a root canal treatment, I'll take a sample or just send the tooth in. And then the other area that we use it is within jawbone lesions, or commonly called cavitations, areas of ischemic bone disease, and we're finding whatever we're finding inside there. So it's a fascinating mix of creatures and microbes that we're finding in these things. And you know, in the past we wondered why certain procedures of ours failed. Yeah. And I've started just a little over a year now measuring these bacterial forms in the tissue samples that I've mentioned to you. So it's anywhere from candida, gram-positive organisms, gram-negative organisms, some very nasty things that we're finding in these life forms in the mouth. And I started doing this because I met a fellow named Dr. Richie Shoemaker from Pocomoke, Maryland. He wrote a book, his first one, he's got several, called Mold Warriors. Okay. Mold Warriors. So Dr. Shoemaker, I don't remember exactly the details of his story, but he was one of the few people back in Maryland that started taking people in his area seriously when they came to him with certain complaints. They had similar stories, and it prompted him to look into some environmental things, not just the medical, what can we do with these folks, because there was people were just wandering around looking for help. And he's a bit of a detective, and he discovered that the thing that all these people had in common, that they were all associated with working in sick buildings. So buildings that have had some kind of water damage, which water damage leads to mold infestations. Certain people are more sensitive to mold toxins than others. So the molds that were found and identified in these buildings have certain toxins, and the toxins is what's poisoning the system. There's neurological consequences, there are mitochondrial consequences, and so when these toxins get into the body, all heck breaks loose, and people just, in some cases, become zombies, living dead. And it's unfortunate. I've had numerous people like this in my office, and so what I do with some of these folks is I'll go in and I'll clean out these lesions that we identify in the mouth that we do know contain excessive amounts of bacteria now, because we've been studying them now for over a year, have solid data, and we're really what we're wanting to do and have as the outcome is lightening the load on their immune system by taking away from the body these sources of contamination that are housed in the jaws that have not been really looked at before. This is brand new, groundbreaking data that we're coming up with in this area. And so I met him a little over a year ago with this. I started seeing people with this problem. He coined the term Marcons, M-A-R-C-O-N-S. It's essentially a way to think of it as a cousin to MRSA. Many people have heard of MRSA, methicillin-resistant antibiotics. Well, MARCON stands for multiple antibiotic-resistant Staphylococcus coagulase-negative organisms. So that's, and it's found in the nose. That's where they're sampling it. In people that have had these mold problems, that's where they're locating this. Well, he enlisted me to do part of this clinical research. We started doing nose swabs and samples of the root canal teeth and these jawbone lesions. So we're finding this Marcons bug in the jaws, because the question was, how can we keep giving people these preparations that we know should kill this stuff, and it's not. or it goes away and then it comes back. What else is going on? So we have been finding a strong correlation between certain people with this problem and with Marcons and the bacterial population in the upper jaw, not the lower jaw.
Interesting.
The upper jaw. We're looking at that. So I got to looking at, okay, Dr. Shoemaker made the connection of why are these people, what do these people have in common? Why are they sick in a similar way? And I said, if he can ask that, why can't I ask it?
Right.
I started asking, what is in common dentally about these people? Yes, they're coming here and they have these problems that I'm doing surgical removals for and treatments and ozone and things like that. And so what am I able to see? And the bottom line is the thing we just talked about was airway. I've been finding most of these people have airway restrictions. If they have airway restrictions, and I mentioned, you'd be suffocating all night long. Well, what does suffocation do? Changes the body's pH. Now, it's not just you can have differential pHs throughout the body. You can have it in an organ, one pH in an organ, different pH in a different organ, and so I don't have a good way yet and thought through how to capture a pH, because once I open up a tissue, I've got a change of oxygenation. I'm going to change the pH immediately. But I'm looking at the structural components of the jaw shapes and sizes relative to that, all that stuff I do on my TMJ exams. And I'm looking and say, these people I haven't got them all documented yet, but they seem to have, as a common denominator, narrow jaws. So if people have narrow jaws, that means they're going to be having airway problems, deficiency in that system, the suffocation, and upset pHs. If upset pH in an acidic environment is going to breed bacteria. Well, that would certainly be why people have reinfections of these types of things, because they're off and they're not able to breathe through their nose or their mouth efficiently, and they have this milder forms of suffocation, not the kind that's going to kill you right now, but it's not going to keep you oxygenating well through the night, and you're not going to have everything that your cells need on board for you to have a good, healthy life.
The infectious agent factor is we use the PCR stool tests, for the various infectious agents, and very reliable. So I thought that was interesting reading through, and of course mold and fungus are huge. So it's good that the data is being tallied up, with respect to that and dental. Because I don't know that there's a whole lot of focus on that, as how is mold getting into the brain and how is it affecting the brain and how well that's being documented. But it certainly seems awfully suspicious.
So we're finding, one of the infectious agents in the brain is aspergillus. And we're finding aspergillus in these cavitation sites in the jaw bones. Well, you've got all this great, huge circulation for the brain and the head, and bacteria travel. And this is a very plausible mode of transmissibility within the organism. For these bacteria.
Well, too, with the nose particularly, because of the cribiform plate in here, essentially, it has a direct line to the brain.
Line,
So, very interesting. So what would be a good example of when you would use ozone injected, as is mentioned in the book? Like, what would be relevant, whatever you...
Right. Ozone is a fantastic tool, and it is used in an injectable form when I have, say, occult pain. Somebody comes in and there's no definable, discernible area of pain that you can put your finger on and say this is where it's coming from in a tooth problem. Well, a number of injections of ozone can eliminate pain. As few as 2 injections. 2 weeks apart.
Okay.
So that's probably my number one way that I use ozone directly injected. From a pain perspective. I do use it during my surgery, kind of as do 2 times. One will take ozone as a gas, not injecting, but bathing an area with the ozone gas, so we're flooding it superficially with gas, and we also will inject it into one of the folds of the mouth as like a big balloon, like a little bolus of the material, so that as it fans out in the jaw, it's going to kill the bacteria that are anywhere it's going to go, and it's bringing life-giving oxygen into the area, which is what the tissues need for healing.
Yeah.
So by and large, we have a very nice healing response for the people that we do our surgeries for, which is comforting. And we also use homeopathics part of it too.
Yeah. Yeah, well, I read in there you don't rely on them exclusively, obviously. Well, and that's totally understandable. The same thing when we use homeopathics, or when I use homeopathics, I rarely would use it by itself. So you just get a better synergistic effect, it seems.
Well, they're tools.
Yeah.
If I think of myself as a master mechanic, I've been in practice 37 years. I've got tool chest after tool chest after tool chest of tools.
Yeah.
And I can draw from those tools for the procedure that I'm doing. And because I have them at my disposal, I know how to use them, and I know how to apply them, I know when to apply them. I don't have just one bullet in my gun.
Right.
I've got a whole set of guns.
Right.
And I think when we think about homeopathics and homeopathy, and this is true probably of most things, there's derision about in the media, oh, this vitamin doesn't work. It's been shown not to work against cancer.
Right.
Or this homeopathic doesn't work. Well, if you really read what the articles say, and most lay people will not, most professionals will not, you don't even know if you're using the right form of the vitamin.
Right.
You don't know if it's the right dose of the vitamin.
Yeah.
You don't know if it's compatible with the individual.
Sure.
So there's so many unknowns that are unclear in the article, but the bottom line that comes out in the media, this vitamin didn't work, homeopathics don't work.
Sure.
Yes, they do work. It's in certain contexts. Maybe it didn't work in this. So we have all these wonderful tools, and we can use them. Right. And I use homeopathic preparations in conjunction with my lasers, and I use them with my ozone. And so it's a really orthomolecular approach to things which otherwise, in my practice, I would have to write my prescriptions. You need an antibiotic, and you need to have pain medications. By the way, it's going to be Oxycontin because this is going to hurt you very much. And not to say I never do that.
No, sure.
It's rare.
Yeah.
It's a rare bird that comes in that I need to use that kind of preparations for.
Yeah, I think, you have to be willing to, in reality, all forms of medicine are useful. I'm not saying every little piece of it is useful all the time, but a lot of holistic practitioners are, adamantly one way or the other, and that can be problematic, when we're looking for what works so that you find what works. Right. And, that we have medicine, or conventional, what they're calling conventional medicine, and it is useful. I don't want to go down that road too far, but, there's a lot of division, between conventional medicine and holistic or alternative medicine that maybe just shouldn't be there, but...
Right, so we use the term integrative.
Right.
We like to blend East and West.
Sure.
You don't want to just throw everything away and say, this is all I'm going to use. That's short-sighted.
Yeah. So there are those that believe that cavitations can't be healed or regenerated. Can you give an example of when you would use bone regenerative material, like you mentioned absorbable membrane in the book, to guide bone growth, for
right. So with cavitations, since you were asking about that, you don't necessarily, depending on where it is, you'll need more bone or not. So if it's far back in the jaw, you may not want to have a need to put bone back in there, for instance. Now, I've become very gun shy about doing things at the time of surgery for people for the initial cleaning out if I have to do something. So I say that around a bit gun shy about putting some bone or something in, and I can clarify this, my thinking. With all the testing that we've been doing with the PCR analysis, showing all these vast array of bacteria that are in there, I've got a person here who's struggling because the people that we're doing this for aren't healthy people. So their body is struggling to become right. And if I give their body another something right now to have to deal with while they're still dealing with the infective process that's there, I don't feel good and think that it's the right thing at this time to add another level of coping for the body, something else for the body to have to deal with, and turning bone around. When you say bone graft too, there's a myriad of products that are available on the marketplace, and not all bone grafts work. That's for sure. And some of the reasons I think the bone grafts don't work is because we're dealing with, at least mostly in my practice anyway, a sicker population. And I think over the years I've seen, in over 30 years, people have gotten sicker. We're more ambulatory sick and not robustly healthy as we once were. The further we're away from the ground and from the natural foods which we used to have more of, to processed foods, fast foods, microwave foods, the nutritional values of the foods have gone down, and people don't necessarily want to take supplements, or even if they do, are they the right quality? You've got a whole shelf full of them, and you choose what product, what's going to work for that person at this time. So it's a very difficult decision. So back to your question, many people want to know what to do with the tooth after it's been removed. What am I going to put in there? They want to have an implant. Well, my conversation with them revolves around, let's get you healed first and well. So I say, you may need to have a bone graft later, but let's get this site healed and let's get you out of the woods with your health right now, so that you can come back. I like to use the expression, you can come back and fight another day. Now that you're going to be in a more healthy perspective later, and that's the goal, is that assess where you are and take the corrective actions then, but you're in a better state of health and well-being in order to tolerate whatever it is procedurally that we want to give you.
No, that's understandable. We go through the same process, so to speak. If you're trying to eliminate infectious agents and so forth, you're not going to do it at a rate that is incompatible with their ability to remove the byproducts of killing off those agents. And the same thing I would think would go with, if you're putting something in that is going to stimulate the response, that they would have to be capable of stimulating it to that point where it doesn't become a burden. So I completely understand that. Based on what we've discussed here, is there anything else you'd like to add, at least for the discussion today, based off of the things that we've already talked about, or you think you covered it?
It's a wide, deep area, and we're just kind of niggling the surface here. We're tickling it, and it's tough. But I suppose the thing to impress upon anybody that's going to watch this in the future here is the fundamentals of stability of the jaw and the wholeness of the tooth is a really strong indicator of what's going to be going on in the system. Because if you see kind of exaggerated wears on teeth, there is a problem. It hasn't surfaced to the point perhaps of pain. Many people only use pain as their flag. There's a problem. It's the furthest thing from the truth. I've seen teeth rotted to the gum line, teeth literally broken in half, not a bit of pain.
Interesting.
So pain is a poor signal from the body, there's
Yeah.
something to pay attention to.
Yeah.
And these compensations, the types that we've been talking about, with the simple wear of the teeth, it may be self-limiting, but chances are it's not going to be, and it's going to be a problem that's just going to follow you for the rest of your days.
Yeah. Yeah.
So I made a model a few years ago, paper on paper, of dentistry at the center of a healthcare model, because after looking at the matrix that I had created, I said, really, dentistry is so crucial for so many of the things that we take for granted in our health and well-being. And how many people that you see have headaches?
Yeah.
And many of the people that have headache problems, and they're popping pills and it goes away, and the next day they pop more pills and it goes away.
Sure.
They have a bite problem.
Yeah.
They have some disturbance in the bite, and it could be that they're just clenching from stress.
Yeah.
And it has nothing to do with an airway problem.
Yeah.
It's an emotional problem.
Yeah.
But it's
Well, that's interesting. Yeah. No, that's a good point. In fact, I just had a woman in a few days ago who out of all of the sudden, now she had the same problem maybe 10 years ago, and all of a sudden in the last 2 weeks, her front teeth are touching before her back teeth are touching. So I'm like, well, okay, well, we'll take a look at it. You know, I unlocked her jaw at one point before. It's not my specialty, but I'm capable of, you know, taking care of some things. And she came in, and I went and checked around the masseter and, you know, posterior neck and the musculature there that might be related. Interestingly enough, in this case, that's really all it took, you know, was releasing what appeared to be some points in her masseters and you know, person who had some upper cervical issues in the past, and you know, voila, they're closing. Obviously, she needs to go and be more, you know, evaluated by someone who's a specialist in that area. But it's just interesting, the things that you'll see, which I'm sure you see that kind of thing all the time.
Yeah. So what came first, the chicken or the egg in that situation?
Right. Yeah, right, exactly. And she, like I said, in her history, she had it before, but out of nowhere, you know. And so, like you said, it gets very complex. There's a lot of factors involved, and you know, you could analyze them until the cows come home.
Could be nutritional.
Right, that's true. Yes,
issue.
it could be.
And
yeah.
An example, I met a man many years ago. I can tell you when it was 1991. He had what would be described as a wry neck, okay, spasmodic torticollis.
Yeah.
That's all he could do.
Yeah.
Okay, felt bad for him. It's the first man I ever met, the first person I had ever seen with that malady. And months later, he came in and he was just as straight as could be. And I says, "What'd you do?" He says, "I can't tell you." I said, "What do you mean you can't tell me?" He says, "I can't tell you. I'm sworn to secrecy." Well, he ended up seeing a fellow that I happen to know that diagnosed through electric acupuncture techniques that he was niacin deficient.
Yeah, okay.
And he started him on niacin, and his neck just came right back online, and he was just as happy as could be.
Yeah.
He tried to tell his support group of all this spasmodic torticollis sympathizers with him to go see this guy, check it out. Not one person had an open mind open enough to go out and look outside the box.
Well, it's interesting because we do, you know, I have been using that for some time and correlating labs, which we talked about, I think, in the first video with, you know, EAV or electroacupuncture, and various names people call it. But I find it interesting that sometimes you can find things with that later you can verify through various tests, or vice versa, you know, and there is definitely something to it that is not coincidental, you know. So any, like we said before, any tool, the tools that you have, if they get you to the point where it helps, then that's a useful tool.
Yeah.
at that time.
Exactly.
So, well, I want to thank you for coming in last minute.
You're welcome.
And thankfully we could line it up, and it's great information. And then again, the book, Holistic Dental Matrix, it's great.
Thank you.
Really. So,
Thank you very much.
Dr. Nicholas Meyer.